diseases that increase your risk of COVID could best be prevented, could best be managed by being vaccinated.
Great.
So it still requires the approval of a TARGI. When do you realistically expect this to be available?
It's not just a TARGI, which will probably be fairly quick, but there's also getting supply from the United States.
Because everyone's racing to get this to
They are, so it'll take 3 or 4 weeks.
Okay.
But it's something we all want to reassure people, this is a safe drug, right? Because there are a lot of people out there who think, well, I don't want to give something like this to my kids. We've had vaccine hesitancy for the last few years. We are very compliant in this country, but we want to stress that this is a potentially important thing for this next wave.
It is, and I'm not rushing to reassure people. What I say always is, let's look at the real-world evidence.
Yep.
And we've already got 500,000 children under 5 in the United States safely vaccinated.
Great.
We said the same with primary school children. Get the good experience and then proceed.
Okay, let's talk masks here, Professor, because health officials are pushing for Australians to mask up indoors at the moment as this winter wave surges across the country. What would you say to people who are reluctant to put on a mask at this stage? Because mandates just aren't going to happen.
Well, masks are a pain, they're uncomfortable, but they're not that bad. I've got them in all of my pockets. I use them. They're really good in indoor settings where ventilation isn't so good, at work, in public transport, on aeroplanes. They work, but they need to be done as part of a multi-pronged approach. And part of that is if one person's wearing a mask, I'll wear it too. So you model for each other. You help each other to do the right thing, but then you also do the other things, social distancing, washing hands. It's only going to work if we pull together, and even if we reduce transmission by 20-30%, we can get the pressure off the hospitals.
Yeah, that's the most important thing, because hospitals and the staff they're just under so much pressure. We want to do our best by them. So many people are saying, though, that this could be the worst wave we've experienced. Have we learnt from the past mistakes? I mean, no one wanted to talk about COVID for months. We thought we'd gotten through it. And here we are staring down the barrel of possibly the worst waves we've had.
We've learnt a lot, David, but we're still learning. This virus is changing, it's mutating. One of the things it's just done is mutated back to a couple of mutations ago. So it's turning back on itself and reinventing itself as like it used to be. So it could be that it's running out of options. So we are at risk right now. Thousands are dying in Australia in the last few months, compared with only 2,000 in 2 years. We need to act, and we really need to redouble our efforts.
Always good to have your insights, Professor Robert Boy. Thanks for joining us this morning.
So to come more